my name is Robert Mararu. I'm a medical assistant here at Synergy Medical for about 2 years now, and I'm joined with Miranda Sattam, a physician assistant who has been working here for about a year now. And so how long have you been working with type 2 diabetic patients?
So I've been a PA for about almost 3 years now, and since I've been starting, working as a PA, I've been seeing diabetic patients.
Okay. So how many patients would you say you see every day that have type 2 diabetes?
Oh, probably about 5 or 6 a day.
5 or 6
Maybe,
a day?
yeah, maybe around there.
Out of total like 15, so maybe like 1/3 of the patients you see have type 2 diabetes?
Yeah, I would say I probably don't go a day without seeing one.
Okay. And would you say that the diagnosis for type 2 diabetes has been increasing in our office?
I would say so. We
Okay.
probably have had some more new onset diabetics.
Okay.
Definitely.
Yeah. And so what exactly is type 2 diabetes?
So diabetes is essentially an issue with the pancreas and insulin secretion. So a couple things that could kind of cause that. Genetics play a big factor, and diet also plays a big factor. And essentially with type 2 diabetics, with increased amount of blood glucose, the pancreas just kind of gives up. It is unable to release enough insulin to reabsorb all that glucose in the bloodstream. And usually caused by, multifactorial, but usually diet and genetics are the two biggest things in terms of type 2 diabetes.
Mm-hmm. Okay. So you said that the main risk factors you would say is like diet and or lack of exercise?
Yeah, the biggest one is going to be carbohydrate intake, having a diet higher in carbs, especially like excess sugar and things like sodas and things like that. And then definitely, sometimes some people can just have more increased risk for glucose intolerance. So like things like PCOS in women, and family history of any metabolic issues like that.
Okay. Okay, so why would you say it is important for patients to manage their type 2 diabetes?
There are so many complications that come with uncontrolled blood sugar. Essentially, when you have high levels of sugar in the blood, it likes to attack the small vessels in the body. So 3 that we're primarily concerned about, the sugar attacking the small vessels in the kidneys, leading to chronic kidney disease. We have some patients whose sugar goes uncontrolled for a while and they end up on dialysis or needing kidney transplant, things like that. The sugar also likes to attack the small vessels in the eyes. So we have a lot of our patients have annual eye exams to check for that. Essentially, if it's left uncontrolled, can cause vision loss. And the main third one that we think about is the nerves in the feet. So some diabetic patients can start to exhibit numbness and tingling in the feet, which can cause increased risk of falls, developing wounds that they don't feel that can go to the bone and can have serious complications in terms of like wound healing and things like that.
Mm-hmm. And how would you say this affects the life quality of type 2 diabetes?
Oh, significantly. Patients who are on dialysis have to go to a dialysis infusion center 3 times a week, and just sit there for hours as they have their blood mechanically filtered. Patients who have like severe wounds on the feet can get really serious bone infections and be on antibiotics for up to 6 months. There's very significant effects of quality of life, especially like with vision loss and things like that.
And that would obviously increase costs of healthcare as well, right?
Oh, definitely. Our diabetic patients are in the office every 3 months just seeing us here, let alone other, specialists that they're seeing, nephrologists, eye doctors, if they need more medications and things like that. Sometimes they warrant even more appointments,
Right.
and definitely can up the cost in terms of overall healthcare.
Yeah. So it's pretty crucial that type 2 diabetics manage their diabetes just to have a healthier life quality, even a longer span of life, decrease healthcare costs.
Definitely.
Yeah. And then what are some positive changes that patients might notice when they're managing their type 2 diabetes?
A lot of them will tell me that they just overall feel better. They don't have that kind of like sluggish feeling when their sugar is really high. A lot of the time when we are improving, limiting carbohydrates and things like that in the diet, weight loss is another thing that patients will notice that, they're happy about, clothes fitting them better. And just like I said, the overall, less complications that come from it. Like a lot of patients who are uncontrolled, once we get their sugar controlled, their kidney function improves, a lot of those types of factors get better. Their cholesterol improves. It can improve their overall health as well.
Right. Okay. So from your experience with type 2 diabetics, what would you say is the best way of managing type 2 diabetes?
I would say the biggest thing is patient compliance. So making sure you're here every 3 months to get your A1C, which is the test that we use to check your blood glucose levels on an average of average of 3 months. That gives us a lot of information to help adjust medications that we prescribe. And on that note, making sure that you're taking the medications every day. And then the biggest one as well is going to be making sure that we make those dietary changes. So focusing on a lower carb diet, focusing on high protein foods, limiting processed foods, excess sugar. I always tell patients if you drink pop, that's an easy one to kind of cut out and improve the sugar levels drastically. I would say those would be the biggest things.
Okay, and then what would you say are some simple exercise activities that patients could do?
Walking. Just walking. Go on a walk, get some fresh air. Walking is usually if patients can't do anything else, that's usually the easiest, cheapest, and most effective form of exercise that a patient can do. We don't realize how sedentary we are throughout our day, so just getting up and making sure that we're walking. Obviously, if we can include any aerobic exercises or anything like that, cardio, that's always going to be great too. But at the bare minimum, walking.
So aerobic exercises is like cardio, like running?
Yep, running, machines at the gym, things like that, ellipticals, things like that.
Okay. And then for eating habits, you said cutting out carbohydrates, so sugars, all that, soda.
Yep.
So what would you say is a good diet?
I would say a diet that primarily focuses on protein and fiber.
Okay.
So usually I tell patients, I don't want you to cut sugar completely out of your diet. That's just, a lot of time patients hear that and they don't even try.
Right.
So just making sure that they are incorporating more protein than carbs in the diet. So if they're having a little bit of rice, just make sure they have a full serving of protein, such as like a chicken, and then some sort of vegetable to go with that, just to make sure that overall they're balancing their meals and making sure that they have that protein and fiber intake.
Yeah. And then how do you think sleep and stress may affect blood sugar levels?
I think a lot of the time when people are stressed, eating becomes a big factor in it as well. A lot of people will tend to eat more processed foods, don't have time for cooking when they're stressed out, eating out more. And, when patients are eating out constantly at meals, I don't think, people don't realize how high in carbs those meals might be. So definitely we see that a lot with patients who are unable to cook from home due to stress factors and things like that. And then sleep can definitely play a factor too. If, they're feeling exhausted every day and they're going to Starbucks in the morning and getting a caramel macchiato every day, that kind of caffeine with the excess sugar and things like that can definitely worsen diabetes. And just the, wanting to, like I said, going out to eat more and not being too tired to prepare your own meals and things like that.
So typically stress and sleep is usually affecting your diet more than this stress and sleep itself.
Yeah.
Affecting the blood glucose. Okay. And then what are the most common challenges you've seen in type 2 diabetic patients when facing type 2 diabetes?
I would say as of right now in the medical world, the biggest thing is probably access to medications. There's a lot of medications that are newer that we have now where it's harder to get coverage. That is probably the biggest barrier that we face. We have a lot of patients who would benefit from some newer medications and would really help control their sugar, but unfortunately it's just not covered by their insurance, and if they were to pay out of pockets, it would be way, way, way too expensive for anyone to afford. So that's one thing we really struggle with some of our diabetic patients and insurance plans, is trying to find a good regimen for them that's within their means and covered, and will also help improve their numbers and their A1C.
Right. And then I've definitely seen that around the office as well. Not many medications being covered. And then would you say that these ways of managing type 2 diabetes could decrease the need for medications, such as decreased carbohydrate diet, exercise, good sleep?
Yes, all that would definitely, you're saying in terms of like preventing diabetes or improving it?
Let's say a type 2 diabetic patient is needing to go on a medication, would you say that losing weight and diet could prevent having to go onto that medication and increasing healthcare costs?
Oh, definitely. I feel like patients sometimes, they just want to take a pill and they just want to hope that the pill, improves the numbers. You can be on all the medications you want, but if your sugar or your diet is poor and you know, you're not getting adequate sleep, your stress levels are high, things like that. We can throw all the medication, but it won't bring that A1C down until we adjust other, you know, lifestyle changes and things like that. It can definitely help starting medication, but ultimately the patient needs to be involved in their care, you know, at home too.
And what advice would you give our patients who have type 2 diabetes, who feel overwhelmed or unsure of where to start?
Take it day by day. So making small swaps throughout the day. Now, I don't expect a patient to completely cut out all the sugar, throw away all the sugar at their house, all their snacks, things like that. Everything in moderation. Making small changes throughout the day is going to make the biggest impact, and just making sure that you're following up. You know, I always tell patients if they ever had any questions, they can always message us. We always give them information on like diabetic diet and things like that if they're a new onset diabetic. And there are a lot of resources to help. Some patients want to go see nutritionists, so we refer them to that to help with carb management and things like that. So just taking it day by day, making small swaps, and you know, just being present at your visits, and making sure that you're following up and you know, have good patient compliance.
Okay. What misinformation or misunderstandings about type 2 diabetes do you often hear from patients?
I think a big one is patients don't understand what a carbohydrate is. So we spend a lot of time talking about what the sugar exactly is, what it looks like in their diet. Another big one is the complications that come with diabetes. A lot of people just say, oh, you know, I feel fine, my blood sugar's fine. But they don't understand the risks that we talked about earlier with the kidneys, vision, feet. So a lot of patient education describing all of those complications that can come from it. A lot of patients don't like to check their sugar at home because they don't like poking themselves. So explaining the importance of that as well.
Have you ever seen any patients who might not really believe that type 2 diabetes is a severe health complication?
Yeah, I'll have patients with really uncontrolled sugar who say, oh, I'm not a diabetic. Or, you know, patients that stop taking all their medication because their A1C was fine and say they're not diabetic anymore, but it was well controlled because they were on the medication and things like that. So we definitely have, not a lot, but definitely that you do see those occasionally in healthcare who just either don't understand or, you know, refuse to accept the diagnosis.
And could you say that a patient with type 2 diabetes could be cured if it's managed effectively?
So unfortunately with diabetes, that's one of the conditions that is kind of lifelong. Now we can have well-controlled diabetics or diabetics almost in remission who aren't on any medication. However, unfortunately, that diagnosis never kind of leaves the patients just because there are so many complications that can come from it. We want to make sure that we are always screening these patients for those types of things.
Okay, so would you say that a misunderstanding is that type 2 diabetes can be fully cured?
Yeah, that's something I hear quite a few times.
Okay. All right, so what is your final message or your main message to our type 2 diabetics here at Synergy Medical?
Biggest thing is going to be making sure that you are going in to get your A1C checked at least every 3 months, and that you know, make sure that you're taking your medications and following up with a proper diet, and making sure that we're touching base on all of the routine screenings with yearly eye exams, checking the feet for any wounds, things like that.
Okay. All right. Thank you so much, Miranda. It was great having you, and thank you so much for sharing some information with us, with our patients. And yeah.
Happy to help. Thank you.